talking to you about an important topic, that is breastfeeding. As we all know, exclusive breastfeeding is recommended for all the babies till 6 months of age and thereafter to be continued till 2 years of life. Why breast milk is unique and superior to other milk substitutes? As we all know, breast milk is superior to other milk substitute in its nutritive factors, immunological properties, as well as the long-term benefits. Coming to the nutritive properties, breast milk contains more of whey protein. Now, whey protein is easily digestible and it causes less load on the baby's immature gastrointestinal tract as well as kidneys. It also contains enzymes like lipases and amylases which aids in digestion. Then coming to the immune factors, it also contains live cells and immunoglobulins which helps in the protection of the baby. It contains immunoglobulin A, it contains lactoferrin lysozyme which protects the baby from severe gastrointestinal and respiratory infections as well as ear infections in the first year of life. It also contains probiotics which helps in the growth of good bacteria in the intestinal tract of the baby. Now, it has been seen that exclusively breastfed babies have less incidence of allergic disorders like asthma or atopic dermatitis later in life. So the initial milk, which is known as colostrum, it is thicker but it is lesser in quantity. It is more nutritious and rich in immunoglobulins. This is lesser in amount but it will be enough for the baby. After the initial 2 to 3 days, the milk will increase in quantity, retaining its nutritional and immunological factors. Now, there are certain questions that every mother asks when they start on this breastfeeding journey. They ask questions like how often to feed and how long to feed. Now, how long to feed? So, in this context, you should know some factors. Initial milk, which is known as the fore milk, is more watery and it helps to quench the thirst of the baby. Whereas the latter part of the milk, which is the hind milk, it is richer in proteins and fat, and this helps in weight gain. So you should feed at least around 15 to 20 minutes. A shorter feed, that is a feeding which lasts only less than 5 minutes, will deprive the baby of the hind milk, which is more nutritious, and then thus reducing the weight gain. Now, how frequent to feed? So the more you feed, the more milk you will produce. So you should at least feed 8 to 12 times a day, of which 2 to 3 times should be at night. Now, how to ensure that your baby is getting adequate breast milk? So for this, there are certain points that you should notice. First of all, the attachment should be proper. So once the baby attaches, you should make sure that the baby is attaching not just to the nipple but to the areola as well. Apart from these, there should be at least 6 to 8 times of wet diaper a day. The baby should sleep at least 2 to 3 hours after a feeding session. There should be at least 2 to 3 times of stool per day. And apart from these things, there are certain objective parameters like weight gain that should be assessed. So after the initial few days of weight loss, by day 10, the baby should regain the birth weight. And after this, baby will be gaining weight at a rate of around 20 to 30 grams per day. So these are certain factors that you should ensure to make sure that the baby is getting enough of breast milk. Now, there are certain queries often asked by mothers who resume work after 2 months of leave. So before you start working, you can start expressing your milk and storing it for your baby. So you can store it in clean containers or storage bags in the freezer for up to 3 months. Now, once you start working, ensure that you are pumping or nursing every 3 to 4 hours. And there should not be a gap more than 5 hours between a feeding or a pumping session. Now, how to store breast milk? So breast milk can be stored in clean containers or storage bags which is made for this purpose. And you can store breast milk in room temperature up to 3 hours in a temperature of less than 25 degrees Celsius. You can store breast milk in refrigerator in a temperature of around 0 to 4 degrees Celsius up to 3 days and in the freezer up to 3 months. And once you use the refrigerated milk, you have to thaw it or warm it in warm water. And once thawed or warmed, you can't refrigerate it back. Ensure that all the utensils that you use to express the milk or store the milk are clean and sterile. That's all on breastfeeding. So breastfeeding is a beautiful journey. You are not alone in this journey. We are with you. Thank you.